afternoon all. May I start? Good afternoon all. Uh, Presenting the paper on the topic Association of Vertical Cup Disc Ratio and Disc Damage Likelihood Scale with OCT RNFL in 100 eyes of primary open angle glaucoma. All over the world, the prevalence of glaucoma is rising and is expected to affect 101.8 million people by 2040. And most of the cases it is asymptomatic. So early diagnosis, treatment, and follow-up is required to reduce the ocular morbidity. And for the evaluation and monitoring of the glaucoma, optic nerve head assessment, visual field test, intraocular pressure assessment, these are the most commonly used. And optic nerve head assessment, it mainly depends only on the clinician, whereas visual field test depends upon patient cooperation experience, and intraocular pressure measurement has day-to-day variations and fluctuations. So, cup disc ratio is the most commonly used method of assessing optic disc clinically, and it was introduced by Armali in 1967. It is the ratio of the diameter of cup to the disc, and it has got high inter-observer variability and low reproducibility. And since it does not consider size, small disc with small vertical cup disc ratio are more likely to be classified as normal, whether they actually have glaucoma or not, whereas large disc likely to have larger cup disc ratio may have normal NRR, are more likely to be classified as glaucomatous. And this damage likelihood scale, it's a newly introduced scale by Spieth and colleagues, and it estimates optic nerve damage by considering disc size, and it classifies disc as small, medium, and large, and it focuses on the neuroretinal rim and helps in documenting the area of greatest thinning, and it has got high inter-observer reproducibility. This is the table showing DDLS nomogram. Here it considers the disc size and classifies into small, medium, and large. It considers the location of the cup and width of the neuroretinal rim, and if at all it is absent, the extent of absence also included, and it divides the glaucomatous disc stage into 8 stages and helps in the documenting progression of the disease. And aim of our study is to compare the correlation of vertical cup disc ratio and disc damage likelihood scale with OCT RNFL in 100 eyes of primary open angle glaucoma patients. And this is a cross-sectional study conducted in a tertiary care center in North Kerala. And study population include all newly diagnosed and follow-up cases of primary open angle glaucoma patients who have met our eligibility criteria, and sample size were taken as 100 from the formula for linear correlation of two quantitative variables. And exclusion criteria were the following. Study procedure: all patients underwent detailed anterior segment examination. Cup disc ratio, OCT RNFL scan were also taken. Disc diameter is calculated with VOC 90D lens with correction factor of 1.3 in slit lamp. Then disc was classified into small, medium, large based on size. DDLS stage and score is calculated based on DDLS nomogram. Data was entered and analyzed, and results: mean age was 58 plus or minus 11.35 years, and 55% were females, 45% were males. And of the 100 eyes examined, majority of 66 eyes had medium sized disc, and of the 100 eyes examined, more than 93 eyes has got cupping of more than 0.6. And DDLS stage, 52 eyes come under category of at risk, 44 eyes come under category of glaucoma damage, and 4 eyes come under category of glaucoma disability. Now, correlation values. After correlation, we have got a moderate negative significant correlation between CDR and RNFL inferior of minus 0.560, whereas with RNFL superior, minus 0.464, and with DDLS, moderate negative significant correlation of minus 0.580 with RNFL inferior and minus 0.570 with RNFL superior. And on comparing DDLS with RNFL inferior has got highest correlation value, and CDR with RNFL superior has got least correlation value, although it is significant. And these are the values obtained in similar studies. Values were comparable with our study. Now, conclusion: strength of correlation with OCT RNFL is more for DDLS than cup disc ratio. So, in the early diagnosis of glaucoma, disc damage likelihood scale will be more helpful than the conventional vertical cup disc ratio method, and superior diagnostic ability of DDLS scale may be due to combination of both disc size measurement and neuroretinal rim width assessment. Thank you.
Thank you very much. That was very nicely presented. Can you just explain to us why you went to DDLS instead of, say, one of the newer technologies like OCT?
Because DDLS is cost effective and relatively simple. In most of the centers could not afford high, and patients also could not afford high end imaging due to cost. So DDLS could be helpful in, since it has got high correlation with structural OCT RNFL. We can correlate and may help in early diagnosis.
Thank you.
Thank you, sir.
Very good presentation. I have one question. You said few of your patients were at risk. How do you define in your study at risk?
Based on DDLS nomogram, we can classify uh, according to yes, at risk, and those risks coming under DDLS category of 1 and 2 were categorized as at risk till they were diagnosed as glaucoma. They were diagnosed as glaucoma and started on treatment, but while I take that patients in my study, they come under at risk category. Yes. Mm. Uh, Same for same patient. Uh, there can be overlap. Yes. Thank you, ma'am.